During your Sculptra prep, you're going to start with a consultation with Dr. Schwartzberg, in which you can discuss your goals, expectations, questions, concerns with him. Here you can see him marking the injection points on the patient and how he's going to distribute the Sculptra based on her goals.
After sanitizing and cleaning the treatment area, you will be placed in a prone position,
which essentially just means you're going to be laying on your belly. Next, you will be getting a local lidocaine injection. For most patients, this is the most painful part of the procedure. You're going to feel a little sting, but after that, you're not going to feel a thing. As you can see, there's only one injection point per cheek, which reduces your chances of developing bruising after your treatment. At this point, Dr. Schwartzberg is using a hollow needle to create an insertion point for the cannula that will be used for the actual Sculptra injection. The reason why we use cannulas over needles for Sculptra is because cannulas by design have a blunt tip. This allows them to glide freely under the skin and reach every quadrant of the buttock. This in turn facilitates collagen growth around poly-lactic acid molecules. With only one injection point per cheek, cannulas will allow for a painless experience and minimal to no bruising. Using a needle, on the other hand, requires several injection points, which not only leads to suboptimal placement of the product, but unnecessary pain and excess bruising, all of which can reduce the efficacy of the treatment. So what exactly is Sculptra? Sculptra is a biocompatible synthetic polymer that has been used in cosmetic medicine for decades. Sculptra is primarily made up of poly-lactic acid molecules, which stimulate collagen production, and this collagen then grows as a three-dimensional matrix around the poly-lactic acid molecules, which in turn gradually produces volume in the treated area. Sculptra is actually one of the longest lasting dermal fillers and can last up to 4 years, taking 1 to 2 months to show its results. Sculptra results look and feel very natural, which is why it is the most popular minimally invasive butt enhancement. A major factor for optimal results is the placement into deep subcutaneous fat. If injected too superficially, it will prevent adequate volume expansion and increase the risk of developing lumps and unevenness, which is why it must be injected into deep subcutaneous fat. Both the number of vials in each patient's individual biological response play a huge role in the outcome of the treatment. On average, most patients start with 8 to 12 vials per session for up to 5 sessions, each of which are separated by 6-week intervals. A common misconception is that Sculptra will eliminate cellulite. However, cellulite is caused by fibrous septa pulling down the skin, which can only be addressed using injections. Common but temporary Sculptra side effects include bleeding, bruising, and discomfort, and post-care involves no sitting, smoking, or drinking for 24 hours, no working out for 5 days, and following a massage routine.
Hi guys, I just finished the treatment and I'm super happy with the result because I got immediately the result. My butt got lifted. I had a little bit pain, you couldn't really feel it, it was worth it. And tomorrow I'm gonna have the same result. It will take like 6-7 weeks for the end result. And yeah, thank you so much for having me and thank you so much for the treatment. I'm really happy for the result.